Dear Dedalus family, we are here again at HIMSS TV in Riyadh, Saudi Arabia. We are here with a good friend, Mohamad El Hefty, who is the Chief Digital Officer at Pfizer Saudi Arabia. Hi, welcome.
Thank you.
Well, lovely to see you again. Tell us a little bit about what you're doing here today.
Actually, very pleasant to be here today. I'm a physician by training with subspecialty in preventive medicine, public health, and digital health as well.
Oh, amazing.
I've been in the journey here in Saudi for worked in different sectors, actually, in the public sectors, from healthcare delivery to strategies, implementations, and public health, and then turned to work in the pharmaceuticals as well. Now leading the digital efforts at Pfizer Saudi Arabia.
Fantastic, that's amazing. And what's your sort of interest around HIMSS today? What are you looking for? Kind of when you see something, what do you think is the thing that most takes your focus?
Well, definitely, I've been actually a member of HIMSS for quite a while, and been also lucky to be once a scientific member in one of the events, and I believe it brings the top-notch technologies to really enable the digital health ecosystem in the country, where it's very ambitious, I would say, and at the same time trying to build this kind of partnership across the ecosystem.
Fantastic, that's great. Look, I mean, we've been walking around the corridors the last few days, and everyone's talking about digital transformation. What do you see digital transformation doing for you?
I'd be a little bit biased, actually.
Yeah, absolutely. That's okay.
Being a physician who is working in the preventative care, I would say the ambitious Vision 2030 of the Kingdom is moving heavily towards the enabling well-being.
Okay.
And at the same time, this is actually aided by technology. So I think this is going quite well so far. We have seen lots of implementations of these digital health solutions and technologies across the kingdom. And now I think it's the time for not only focusing on the governmental sectors. There are quite good opportunities for the public partnership as well, public and private partnership, I would say,
of course, yeah.
to really enable the ecosystem, and of course putting patients in the center of our efforts.
Absolutely right. So now we see a lot of digital transformation. What do you see as the key that is going to sort of be innovative over the next 5 years from today?
So just echoing on what I was saying about the ambitious Vision 2030.
Yes.
There are a very brave arm to try to really nourish the digital efforts in Saudi. Hence, we see all these kind of implementations across healthcare industry. And I think the next move for healthcare is going to be health rather than healthcare.
Oh, I see.
We're providing longevity, of course, and at the same time trying to make the whole health ecosystem based upon not only a patient, but I would say a person, where he will be enabled to seek the best lifestyle practices to really prevent him from encountering any kind of sickness.
That's great insight. Thank you for that. The other thing I wanted to ask, and this is probably more of my final question, there are a lot of people out there that are going to be watching this, younger people than you and I probably, and that are going to want to be getting involved into health informatics or maybe pharmaceuticals. And what advice would you give those, up-and-coming physicians or up-and-coming informaticists? What would you say to them?
Well, actually, I look at myself back in the days when I really wanted to try this, and it actually, as part of the passion, now not even a luxurious thing to be enrolled in this kind of industry, but I think it's becoming more essential. And I think I was very lucky to be part of different work groups to really enable the digital health workforce. We've published the Saudi Health Informatics Competency Framework, trying to put what kind of competencies are needed for the market, and then trying to link these kind of competencies with the market, private sector, governmental sector.
Right.
So we have the best workforce that are like really ready to just enroll in the system. And at the same time, since this is now there, amidst this kind of transformation that is happening, I think it's even a good opportunity, not only from the governmental sector, but also from the private sector to really tap into the capabilities that are generated in Saudi, and at the same time, putting this kind of clear career pathway. We were lucky actually to publish also a scientific paper targeting or unlocking the potential that we have for the career pathways for this kind of specialist in health informatics. And also to add into that, there are different opportunities, I would say, for the workforce that are available.
Yeah.
And I really encourage them not to only focus into places where digital health would be named or tagged as per se, because I believe it's actually a mixture of interdisciplinary approach. You can have whatever kind of background, but even adding to the digital health ecosystem as a whole.
That's great. Thank you, sir. So great insight from Mohamad, and I look forward to seeing you again next year. Thanks for the wise words.
Nice. Thank you so much.
All right, thanks.
Sam.